Of nutritionscience.in and sampurnahara.com. I'm a lifestyle physician. I studied yoga and naturopathy and I graduated as a yoga and naturopathy physician. And I decided to dedicate my life to lifestyle medicine, to helping people live healthier and longer lives when my grandparents reversed diabetes and hypertension using evidence based nutrition. In today's video, I'm going to be talking to you about how you can do the same at home. What is the science of diabetes? How is it caused? And how can you reverse it? And how do you actually go about doing that? So, in India today, there are more than 7 crore people living with diabetes. If you are one of these 7 crore people watching this video, or if you know someone with diabetes and you're sharing it with them, I sincerely hope this helps you and your family live happier, healthier lives together. In 2014, my grandmother had been suffering from diabetes for 30 years. She remembers the time when she was first diagnosed. She had gone to the doctor and she had gotten high blood sugar. So the doctor said, "Oh, we'll have to start you on medicines." And she said, "Medicines? Isn't there anything else I can do? How do I avoid this?" So the doctor said, "You try whatever you want, but I don't think you'll be able to avoid it. You might need to start medicines at some point." So she said, "Okay, I'm going to try." She went back home. For the next 1 year, she tried everything she could think of and everything she found on, looking at books and magazines and newspapers. She talked to doctors, she talked to her friends or relatives. She tried walking every day. She tried drinking a lot of water, methi seeds, methi powder with every meal, bitter gourd juice, bitter gourd palya, sabji poriyals. She tried using whole wheat, soya chunks. She cut down on rice and wheat, but none of it worked. Eventually, she was forced to take medications. After a few years, she was forced to take insulin, and it only went downhill from there. Every year, her insulin requirement would increase, and so would her sugar levels. When she went back to the doctor, year after year, he would see her sugar levels and say, "Oh, this is higher than last year. Um, you know, you need to improve your diet. Here's another medicine." And they'd send her back home. But that's about it. You need to improve your diet. That's all the advice was given. What do you do? How do you actually improve your diet? She was not taught during that consultation. She even consulted dietitians, nutritionists, but still her diabetes was not reversed. In 2014, when she and my grandfather went to the Pavitra Nature and Yoga Hospital in Coimbatore, in 10 days, she started eating a plant based diet, a naturopathic diet, and started practicing yoga. In 10 days' time, my family wouldn't believe it. Her sugar levels came down from, it was usually in the 300s range after food. It came down to 140, which is normal sugar levels. And this is the best part, this happened with less medications. So my grandmother used to take 24 units of insulin and 6 tablets a day. She brought it down to 8 units and 1 tablet a day and brought her sugar levels back to normal. Now that is called diabetes reversal. When you reverse diabetes, it means that you're able to achieve normal sugar levels with less medications and less insulin. So you're healthier, right, overall. And when she came back home, my family was so surprised and happily surprised that she has gotten so much healthier. And that's when I dedicated my life to lifestyle medicine. And one of the first patients I had in the first couple of months when I started my practice, I remember she was a doctor and she was taking 100 units of insulin. She had been diagnosed with diabetes a few years back. She was taking almost 100 units of insulin every day, spread across 3 to 4 injections a day. And 1 month later, after adopting a plant based diet, in 1 month's time, sugar level back to normal. She was completely off insulin. This was the amazing part. Lower sugar levels on lower medications and lower insulin requirements. That's the power of healthy eating. So in this video, I'm going to be sharing with you how this actually works, why it works, and how you could start achieving the same thing at home for yourself and your family. So, what causes diabetes? A lot of people think diabetes is a problem with the sugar in the body. In fact, most people just call it the sugar disease, right? In India, many people don't even say I have diabetes, they say I have sugar. Right? It's true that a symptom of diabetes is a high sugar level, a high blood sugar, but that's not the cause, that's only the symptom. Right? For example, if you say that you say you injured your knee and you have pain, yes, you have knee pain as a symptom, but knee pain is not the problem, the injury is the problem. And let's say you injured yourself while you tripped on a wire across the room or wire across the hall. What is the solution to prevent this from happening again? You move the wire, make sure that it's not there to trip, or you be more careful while walking. Don't trip and fall, and you won't get hurt. The pain won't be there. Yes, you can treat the pain with painkillers, but if you keep tripping down, you're going to keep falling, re injuring yourself, and the problem never goes away. Right? So, what is the root cause for diabetes? The root cause for diabetes is the accumulation of saturated fat, specifically inside your muscles, liver, and pancreas, which gets oxidized and which causes oxidative stress. So, I'll explain this whole mechanism, what it means, and how it happens. When you eat food, the food gets digested, absorbed into the blood, and transported to all the cells in the body. The problem is your cells cannot absorb glucose by themselves. They need the support of insulin to do this. So, insulin acts like a key that opens the door of every cell. For example, if you're standing outside your home, if you have your house key, you can open the door and enter. But someone else standing outside your home, they need to knock, they can't open the door, right? So, like that, insulin is like the key which opens your door and lets glucose inside the cells. The problem in diabetes is insulin's action gets blocked. This happens because of something called intramyocellular lipid accumulation, because we doctors don't like to make anything simple. It simply means fat inside muscles, cells. That's it. Small droplets of fat that have gotten clogged up inside our muscle cells, those cause something called insulin resistance. They clog up the locks, they jam the doors. So even if glucose and insulin are right outside the cell, they're trying to open the door, they're trying to enter, but they're not able to enter because the doors are jammed. It's like you're outside your home, you're trying to open the lock with the key, but the lock is jammed. You have the key, but can you open the door? No, you can't do it. Right? So what do you do? What's the solution? You call a carpenter, unjam the door, fix the door, and then you can go in and out easily once again, right? It's the same thing in insulin resistance. Insulin resistance is caused by the saturated fat droplets that get stuck inside muscle cells. So, what's the solution? You clear out the saturated fat. Diabetes is a disease of fat accumulation, not sugar accumulation. Sugar accumulation is a symptom, not the cause of it. So this is the first problem. The second problem is something called beta cell loss. So what happens in your pancreas is when the same fat gets clogged up inside the pancreatic beta cells, which are the cells responsible for secreting insulin in the first place, they start dying. And when those cells start dying, the quantity of insulin secreted also starts reducing. So first of all, the insulin production is reduced, and the insulin that is there is not able to do its job properly. Overall, the result is your glucose gets stuck in the blood itself. It's not able to enter the cells. So when you measure your blood, where can it go? It can't go anywhere. It's stuck in the blood. Beyond a certain point, the kidneys can excrete some of the glucose, but until then, it just keeps building up in the blood. So when you test your blood, you see a high blood sugar. What does that mean? It means the sugar in the blood has not been able to enter your cells and has gotten stuck there. Okay. So medications and insulin injections play a very important role in diabetes treatment. They keep you healthy, they keep you alive, they prevent the risk of complications and the risk of death if you have diabetes. But the problem is medications and insulin don't reverse diabetes. They don't solve the root cause. The fat sitting in your cells is still sitting there no matter what medicine or insulin you're taking. So the only way by which you can reverse diabetes is to treat the root cause and allow the body an opportunity to heal itself. See, the body is a powerful self healing machine, but it needs your support to do that healing. It needs your support in the form of a healthy diet, physical exercise, and mental relaxation in order to make this healing happen. So, going back to the root cause for diabetes, it's the insulin resistance and the beta cell loss that lead to a high blood sugar. By the time you're diagnosed with diabetes, approximately 50% of your beta cells are already dead. That's when the sugar level starts going up. Until then, the body is able to manage somehow, right? So, what happens after that? The number of beta cells only continues going down, it continues reducing. That's not a good thing. But the good news is when you change your diet and lifestyle, when you start eating healthier, when you start exercising more, you start feeling more relaxed mentally, your insulin resistance starts reducing. The fat starts getting cleared out from your muscles and your liver and pancreas. Insulin resistance reduces, and your beta cell loss also starts slowing down. So by the time you complete 2 years, after 2 years of a healthy lifestyle, research has found, and this is recent research, I think 2 3 years back it was published, they found that your pancreatic function can return almost completely to normal levels. How cool is that, right? You start eating a healthy diet, and in 2 years, it's almost as if you never had diabetes. You're back to normal. Now, that is the healing power of the human body if we support it with the right diet and lifestyle. So now that we've discussed what causes diabetes, let's talk about the treatment approach. What do we do? If you have diabetes, what are the next steps? How do you start going about treating it? The one thing that I recommend is to set your goals right. Not diabetes management, not merely diabetes management, but actually diabetes reversal should be the goal when you approach diabetes treatment. So if you have diabetes and you go to your doctor, you need to tell them, doctor, I want to reverse my diabetes. I just don't want to treat it. What do I do? And if you're a doctor treating your patients, tell them that diabetes reversal can be a goal and it should be the goal. Now, this doesn't mean that a healthy lifestyle is a magic bullet. It's going to cure your diabetes once and for all, and it's never going to come back. All your problems in life are going to disappear. It doesn't work that way. In fact, no therapy works that way. Nothing is 100% guaranteed. But having said this, a whole food plant based diet, regular exercise, and regular practices of mental relaxation have been shown to be the best way possible to prevent, treat, and potentially reverse diabetes. A majority of my patients see significant improvements. I've told you about the doctor who dropped her insulin levels, insulin injections from 100 units to 0 units in 1 month and got her sugar levels back to normal. There are people who came to us immediately after diagnosis, and they were able to avoid medicines completely, no medications at all, but with normal sugar levels within 1 month of diabetes diagnosis, the diabetes was reversed and it's never come back until today. On the other hand, there are some people who are not able to stop medications completely. There are some people in whom the sugar levels has not reduced to normal completely. But that's fine because even they saw an improvement. At the very least, they were able to slow down or stop the progression of diabetes. Because diabetes by itself, in itself, is not a fatal disease. The problem in diabetes, if you're able to control your sugar levels well, even then your risk of complications increases. Your risk of heart attacks, strokes, diabetic foot, gangrene, blindness, or diabetic retinopathy, kidney failure, or diabetic nephropathy, all of these diseases risk goes up when you have diabetes. So, even if your goal is to simply prevent these complications, the best way possible, apart from any medications and insulin you're taking, is to adopt a healthy diet and a healthy lifestyle. So, what does that mean? What does a healthy lifestyle mean? Well, it means three things mainly. Number one is a healthy diet, number two is physical exercise, and number three is mental peace. Out of these three, the most important aspect is your food, what you eat. Up to 80% of the cause for most chronic diseases comes from your diet, and the remaining 20% comes from body and mind, from exercise and relaxation. So, we'll talk about the food first. When it comes to food, there are two types of food that are high in components like saturated fat, cholesterol, and low in antioxidants, low in fiber, which increase your risk of developing diabetes and other related diseases like the complications of diabetes or hypertension, obesity, heart disease, the other diseases of the metabolic syndrome. What are these foods? The first one is animal foods, and the second is processed foods. So, animal foods include meat, fish, eggs, as well as dairy products like milk and anything that's made from milk. Even foods like ghee, butter, curds, buttermilk, cheese, yogurt, paneer, etc. And processed foods. So, this is basically anything that comes from an animal. It's easy to remember it that way. And secondly, processed foods. Processed foods are any food from which something good is removed or something bad is added. For example, a handful of groundnuts is a whole food. But if you squeeze those groundnuts, you extract the fiber separately and the oil separately. The groundnut oil, regardless of whether you did a cold pressed oil or a refined oil or extra virgin or unrefined, unfiltered, filtered, whatever it is, if you separate the groundnut into fiber and oil, then that oil is a processed food. And when you add 2 spoons of that oil to a vegetable dish you make at home, even that dish becomes a processed food because in the first step you removed something good, you removed the fiber and nutrients. In the second step, you added something bad, you added oil to your vegetables. So, by this definition, practically everything we cook at home is a processed food. But also, it's very easy to convert everything you cook at home to a whole food. Just skip the oil. And you can also the other processed foods like sugar, even jaggery, even honey, even white rice, maida, and alcohol. All of these ingredients are processed foods as well. Now, what do we need to do if we want to reverse diabetes? If that's your goal, then we need to start thinking about reducing and possibly eliminating every one of these foods from your diet. The next question most of my patients ask me is, Doctor, what to eat? These are all the foods we eat every day. You're telling us to just throw everything out. What do we eat? Do we survive on water and salads for the rest of our life? The answer is no. You don't need to go on a diet. You don't need to restrict your cravings. You don't need to control your portions. You don't need to count your calories. You can actually eat anything and everything you enjoy eating as long as you use the right ingredients. Let me ask you a question. Which is healthier, brown rice or white rice? I'm 100% sure that most of you watching this video are going to choose brown rice because you know it's healthier, right? So if you were to make a biryani and you choose brown rice over white rice, you can be assured that that biryani is going to be healthier than a white rice biryani. Yes? That's it. It's as simple as that. It's as simple as making small but specific and constant, steady changes to your diet on a daily basis. It's not about what you eat once a year or once in 6 months. That's really not going to make as much of an impact as what you eat on a daily basis at home. Your everyday food, your breakfast, lunch, and dinner decide whether you stay healthy or fall sick in the long term. Diabetes is not a genetic condition. Even if your parents are diabetic, your grandparents are diabetic, your siblings are diabetic, your cousins and aunts and uncles, everyone is diabetic with type 2 diabetes, you need not develop the disease. You have a good chance of being able to prevent it through a healthy enough lifestyle. And following a healthy enough lifestyle is not something that's extremely difficult or impossible to do. They are simple, practical changes that you can make on a daily basis at home that can help you to prevent and reverse diseases like diabetes. So, we have a website called nutritionscience.in. The link is in the description of this video, and it's also the name of our channel. So you can go to our website, check out the courses that we have. We have a free recipe course with over 200 different recipes. None of them use any dairy or meat or fish or eggs or oil or any processed or animal foods. They're all made using 100% whole plant-based foods only. So if you have a craving for, let's say, paisam or kheer, and if you're diabetic and you want to eat paisam or kheer, you can do it. In fact, we have a paisam recipe without using sugar, jaggery, honey, white rice, ghee, butter, or milk. How do you even consider that as a paisam? Because it tastes exactly like one. It tastes fantastic. You can make it. I'll give you an example, right? You can make paisam by grinding up fruits and dry fruits with your rice or dal or whatever base you want to put in it, and add in some nut milk instead of dairy milk. That's it. Three simple things you use. For example, you boil some brown rice, cook it soft, or moong dal, cook it soft, right? You take dates and bananas and mangoes or chicos, grind them to a paste, soak the dates beforehand, that may be easier for you to grind it to a paste, and put some almond milk in it, or cashew milk or peanut milk, which you can make at home very easily. You just grind almonds with water to make almond milk. Or if you want to make it even easier, just dissolve some almond butter in water and you get almond milk. So just mix that in, mix it with your date syrup that you've made by soaking and grinding dates, put a pinch of cardamom powder, and your paisam is ready. The best part is, because these dates and other fruits have all of their fiber intact, because they are high antioxidant foods, and because the brown rice was not processed but a whole food, your sugar levels may not go up. Definitely they won't go up as much as compared to a regular paisam. Your sugar levels will continue to stay stable, and provided you're eating a balanced, healthy enough diet, otherwise, you'll be able to enjoy all the paisam you like while reversing diabetes. Now, that's what I'm talking about. Being able to enjoy your favorite dishes while getting healthier. That's possible by choosing healthy ingredients to make the same dishes you've always made all of your life. If you find it difficult to cook at home, if you find it difficult to follow a course and make these changes at home, we have also set up a plant-based kitchen called Sampurna Ahara, which has served more than 40,000 meals to people with diseases like diabetes over the last 2 years. In fact, last month, let me share a phone call that I received. We got a call from one of our clients' sons, and he said that my father is diabetic. He's been diabetic for the last 30 years. We tried everything we could. We've tried various types of diets. We've tried putting him on different kinds of medications, Ayurveda, Siddha. None of it seems to work. And right now he is on medications, but his sugar levels are still high. They're in the 200, 250 range. What do we do? So he had taken our Sampurna Ahara meal subscription for 2 months. There's a diabetes diet on the website which he took for 2 months. And in those 2 months, he was able to bring his sugar levels back to normal. This is at 75 years of age, right? After 30 years of diabetes, sugar levels back to normal in just 1 month. And in 2 months' time, he lost a total of 6 kgs of weight. He's feeling so much better, so much lighter, so much more energetic, and so much healthier he's gotten just by enjoying his daily meals. He enjoyed his morkarmbu and kotse and poriyal, palyas and vadas and bhaji bondas and pakodas in his daily meals while reversing diabetes. That's the power of a whole food, plant-based diet. So I invite you to try this out for yourself. If you would like to try out some recipes, you can check them out on nutritionscience.in. If you'd like to try out some meals and make it easy and convenient, you can order some from sampurnahara.com. If you would like to come in for a consultation with me personally, I'd be more than happy to guide you on exactly how to approach your diabetic status with your health reports, your medications. We can have a chat and we can put a proper plan for reversing your diabetes together. You feel free to book an appointment with me on either website. You'll be able to do it. If you have any questions, feel free to leave a comment on this video and I'll be happy to answer them for you. And I hope this video was useful for you. Those of you watching live, and if you're watching it as a recorded video, I hope it's just as useful for you as well. And I will look forward to meeting you tomorrow evening at 9 p.m. for our next live video right here on nutritionscience.in. Thank you all so much for joining and have a great day. Be blessed.